Induction and Augmentation. Most women start labor naturally. However, there are some very specific reasons for which you may need assistance to either start or strengthen your contractions. Starting labor is called induction, and strengthening labor is called augmentation. It is important to have a conversation with your healthcare provider about the risks and benefits of these procedures and their practice preferences before going into labor. This will help you make an informed decision about your care. There are various methods for induction. The following two types both soften and prepare your cervix for labor and may start contractions. Prostaglandin is a medication inserted vaginally and applied to the outside of your cervix. A Foley catheter is a deflated balloon tube placed through your cervix and then filled with fluid. You will be asked to come to the obstetrical care unit the day or evening before your induction. At this time, your healthcare provider or delegate will review the information and answer any further questions. After the procedure is done, you will stay in the triage assessment area for 1 to 2 hours to monitor how you and your baby are doing. After this, you and your healthcare provider or delegate will discuss whether you will be admitted or go home. If you go home, your nurse will provide instructions about when you should return to the hospital. You may need to return when you are contracting every 5 minutes, if your water breaks, if you have bright red vaginal bleeding, if you are not feeling the baby move, if you are unable to manage your contractions at home, if the Foley catheter comes out, or if there is any other reason you feel you need to return to the hospital. If you go home and labor doesn't begin by the following morning or within 12 hours after insertion, a nurse will call you to plan the time of your return. You should eat light meals and drink plenty of fluids while at home. Once you come back to the hospital, your healthcare provider or delegate will discuss with you the next steps. These may include breaking your water, the sac of amniotic fluid around your baby, and/or giving you artificial oxytocin. This artificial version of the naturally occurring hormone, oxytocin, is given to you by intravenous infusion and will cause your uterus to contract. After the breaking of your water or the start of oxytocin, you will remain in hospital until the baby is born. Augmentation may be required if you are already having contractions, but your labor is not progressing. This can be done by either artificially breaking your water or with the use of an intravenous infusion of artificial oxytocin. You will remain in hospital until the baby is born. There is a pamphlet available for more information on induction and augmentation of labor.